Hey there, I'm Dr. Hall, and I'm glad that you're joining us today on Amara Health Connect TV. Today, let's talk about the health implications following the devastating hurricane that hit Jamaica. On October 28, 2025, Hurricane Melissa slammed into Jamaica, unleashing winds that reached approximately 185 miles per hour. This was the strongest storm recorded to ever strike the island. Homes were wrecked, neighborhoods flooded, and lives were turned upside down forever. But there's more to this disaster than what meets the eye. There's a looming public health crisis. Health risks after the flood. So let's talk about some health hazards we are now facing following the passage of Hurricane Melissa. The floodwaters have tainted drinking water, damaged sanitation systems, and turned places into breeding grounds for illnesses. There are troubling reports of animal carcasses and lifeless bodies discovered. Also, there are unconfirmed reports of decomposing bodies and mass graves in some isolated areas. The Ministry of Health has issued warnings about rising threats from waterborne diseases, including leptospirosis, cholera, and typhoid, mosquito-borne illnesses like dengue and chikungunya, respiratory infections due to overcrowding in shelters and inadequate ventilation, emotional strain caused by trauma, loss, and general displacement. And we're also likely to see an increase in skin infections, rashes, gastrointestinal illnesses, diarrhea, and other stress-related issues. Currently, almost all clinics in the western parishes are non-operational due to lack of running water and electricity. The public health is now under strain. Right now, Jamaica's public health system is facing immense pressure. To date, over 530,000 people are now without power. Access to health care is hindered due to communication breakdowns and damaged roads. Immunization schedules have been disrupted and refrigerated medications have been compromised. Clean water is also scarce too. Solutions and steps forward. What can we do? To prevent further disaster, immediate action is crucial. Recently, an emergency field hospital equipped with an operating theater and diagnostic equipment was set up in Black River. This is largely due to the efforts of international partners to support local hospitals. Going forward, more mobile health clinics must be deployed in isolated areas hit hardest by the storm. Water purification tablets and hygiene kits need distribution. We should run ongoing public health campaigns focusing on disease prevention and water safety. The cold chain systems for vaccines and medications must be restored. Mental health assistance through community outreach should be enhanced. Immediate evacuations are essential for the most vulnerable, particularly in isolated, devastated regions. Improved sanitation and ventilation are necessary to enhance shelter conditions. We need to solicit the help from local bodies and businesses for technical support. We also need to work with international partners to secure emergency supplies and technical support. The government is collaborating with the UN and NGOs, non-governmental organizations, to assess needs and provide aid. Yet, recovery will take time. We need to be resilient as a people. Hope and resilience. While Hurricane Melissa has challenged Jamaica's strength, every flooded street and shattered home reveals courage. Through united efforts, community spirit, and faith, we can rebuild not just physical structures, but our lives. So, let's support local health initiatives. Stay informed, stay safe. I hope you found this video insightful and educational. Please share it and subscribe to the channel. Thank you for watching.